Hey, Arnie, and the ED department here is the largest in the Montefiore system. The nurses, the night nurses, walked off the job at 7 a.m. this morning, and they've been out here all day in shifts. Yes, this negotiation is going to be tried in the court of public opinion. The real talks taking place at the negotiating table. But this group has strategically placed itself right in between the main entrance further down the block and the Children's Hospital, which is right behind the camera and around the corner. The patients who are walking into the hospital and leaving the hospital, it is the first thing that they see coming or going. In a borough with some of the highest asthma rates in the country. How many people in your immediate household have asthma?
Out of 9 of us, 8.
The nursing strike does not exist in a vacuum, especially for patients like Kim Van Zant, who we met Monday as she and her grandson Stefan, also asthmatic, walked out of the Children's Hospital. How important is this hospital to you and to this community?
It's very important to us because this is the only hospital I would use.
What do we want? When do we want it?
Down at the corner, a large crowd of nurses on the picket line demanding a new contract. That's where we also met leukemia patient Omar Martinez, who expressed his support for the staff, who he says cared for him during a month-long stay at Montefiore.
Each nurse on the floor where I'm at had 4 to 5 patients for 12 hours.
When a nurse goes on break, we have to cover each other. So I can have anywhere between that 6 to 12 patients now if I'm covering someone else who also had 6 patients.
As is often the case during any contract negotiation, especially one involving a strike, it's a battle over terms and the narrative. For their part, Montefiore's management did not respond in time for this report to our questions about the strike's impact, if there is any at all, on the number of canceled or rescheduled surgeries or transferred patients. But hospital officials did forward to Pix 11 News internal negotiation documents, in which Montefiore asserts that it is working to address staffing recruitment and retention issues. On the record, Montefiore sent us a statement written before Monday's walkout. Quote, "Services provided by Montefiore Medical Center will not be impacted by a possible nurses' strike. All patient appointments remain scheduled unless you hear directly from your provider." Now, this strike didn't come as a surprise to the hospital. By law, the nurses were required to give a 10-day notice that they were going to walk off the job. Temporary nursing staff is here on site and at the other hospitals that are affected by this walkout. No telling how long this is going to last. We're live in the Bronx this evening. Jay Dow, Pix 11 News.